My name is Michael Sennett. I'm currently chairman of the Trustees at God's Love. I've been chairman of the board. I was chairman of the building campaign. I'm chairman of the capital campaign. I've had every job at God's Love. Part of that is because I'm HIV positive and I'm a survivor, one of the lucky ones. And there are a whole group of us who, because of genetics and to some extent the drugs that supported us, survived. And I think we have a responsibility to therefore show the same compassion to other New Yorkers that were showed to us. And I think it was that compassion that drove our founders to start God's Love. Ganga Stone was a hospice worker at Cabrini. She was actually looking for a vocation. And the lowest of the low, the people who were pushed aside, who were out on the street, who were not taken care of, were gay men in New York City. And that was the closest people she was to. And a nurse who had a friend who was sick asked Ganga to deliver food to this man because that's what people were doing for him. So Ganga rode her bicycle down and delivered food to a man named Richard Sales. And Richard was in bed, and she put the food on the counter, and the next day she worried about Richard and went back, and the food was still on the counter, and she cooked him dinner. And that's how we started. My connection is I dated Richard Sales, so I was meant to be part of this organization. And from that, she called up strangers to come and cook food for strangers, to deliver to strangers. And it was a reflection of the kind of compassion that many New Yorkers have. And AIDS brought out that compassion, I think, to an enormous number of people. And DIFFA was formed by people of compassion to address that particular issue. And we were on the cusp of doing that very early, 1985. Our 40th is next year. So DIFFA was there before us, and Ganga went to them out of desperation. We were cooking out of a church on the Upper West Side, and we had to disassemble the kitchen every day because the church basement was used by the Boy Scouts and everybody else. So the amount of effort in the beginning was extraordinary. And there were not many people who were aware or willing to support, and DIFFA was originally one of the people that supported. From the beginning, we provided nutrition support. That the biggest thing was the wasting disease, and that's why Ganga chose food as a way to address the AIDS crisis, because so many people were wasting, and so in the beginning we just provided calories, and enormous number of calories. And there was a hospice attitude to us. Everybody knew that the people we were serving were going to die. And yet they came every day and made food. And the success of our organization is the combination of our volunteers and the relationship they have with their clients. That they in fact connect with the clients, and they know they're making dinner for somebody who's going to eat it tonight. And the impact of nutrition and food on people who are dealing with a complicated illness is enormous. It takes pressure off them and feeds them. From the beginning, we fed the house. In other words, we fed whoever lived there, because we knew that if we just provided food for the person who was sick, that person would share it. And so from the beginning, whoever was in the house, the caretaker, the partner, the lover, whoever it was, we provided food for them as well. That's somewhat unique. When I came on the board, I realized two things. One, as the AIDS epidemic moved from hospice to maintenance of a chronic illness and a wide variety of medications, most of them toxic. I have permanent heart damage from the medication. I'm 83. I'm glad I had the medication, but I had permanent heart damage. We realized that we had gained an enormous amount of knowledge about nutrition and nutrition's impact on illness. And we had adapted the meals to your illness, and your medication. And DIFFA was one of the original people that supported our change from just serving HIV people to serving all people who were sick. Because I said, why are we holding this back? If we can treat AIDS patients, we can treat everybody. And there were some in the gay community who pushed back. DIFFA was one of the people who said move forward. We now treat about 240 different diseases, from mental illness to hepatitis, and we're now been given a grant by the VA to treat PTSD, that the impact of proper nutrition on mental illness turns out to be effective. We now term medically tailored meals for everybody. So depending upon your illness, and most HIV patients, by the way, have a combination of illnesses. So comorbidity is added, and that requires more customization. So with DIFFA's help and background, we have 9 full-time dietitians, and about once a month or once every 2 months, we work with the healthcare provider and the patient to make sure that the meals we are giving serves that particular need. I have a chronic illness. I have cancer. I have heart disease. I have a series of things that came off it. I have the money to afford the doctors and the food and the support. If you have a chronic illness and you're poor, and most of the people we serve are poor with a chronic illness, the illness takes over your life. And you have to spend your whole day thinking about it, working on it, going to doctors, going to medication, etc. So to have medically tailored meals support that effort is key in their progress for recovery. And DIFFA has continued to support us as our mission has expanded and changed. For that, we are enormously grateful. We're about to change again. It's dawned on the federal government that keeping people in their home may even be better, but certainly cheaper. God love reduced cost of hospitalizations by 16% because we prevent people from going back, from relapsing. Because what happens is when you are sick and alone, or even with somebody, you tend to have malnutrition or dehydration and are readmitted to the hospital through the emergency room. So we lower readmission rates by about 40%, and we lower hospitalizations by 16%. Well, the federal government said, gee, maybe that's a great idea. So starting next year in the state, federal government has given money to the state to add to Medicare patients a surround support, which will include medically tailored meals, which we will start providing. So we're in the middle of an expansion campaign. Be careful, DIFFA, we're going to hit you up for this, to have the proper structure to serve meals to this population, because we're going to expand the number of people we serve dramatically. We only serve about 17,000 people now, and that's just scratching the surface. And with the Medicaid involvement, we can double that. So we have to double our capacity, and that's just part of the deal we've made. And we have said we'll never turn anybody away, and that if you call us, we'll serve you tonight. You need a prescription from your doctor, but we give you 60 days to do that. So we're immediate, and we're still going. I look at us as a memorial to people who died. And keeping us going is part of recognizing their death and honoring their life. And that's why I stay. When you talk to DIFFA, they understand the need to expand and serve more people. And just as their mission has expanded, so has ours. And so there have been a few organizations that have made that transition to serve not just HIV, but to serve all chronic illnesses, and to recognize the impact of our services on people's lives. And DIFFA was doing this in parallel with us in their own organization, so they were extremely supportive. Some of our other grantees were not as supportive as DIFFA was in these changes. They had been locked into a particular mission, which was only HIV or only hospice work, and they had not seen the possibilities of expanding our services. DIFFA was one of those partners who did see that and therefore supported us through that process, and that was unique. Our foundress was this woman, Ganga Stone, who was looking for a vocation and looking to extend her own compassion, to test her compassion. And she was a unique individual in that regard. And the kind of courage and chutzpah it took to start an organization to serve AIDS patients was enormous. And on her own, she went around trying to collect money. And I think when she approached DIFFA, they were so impressed by her passion and compassion, as well as the need she was serving. Because at that time, so many AIDS patients were alone and untreated and unserved. And I think that Ganga's passion and the story of our patient population appealed to DIFFA, and they responded to that. I certainly have responded to her. That kind of vocation and that kind of compassion. We survive because we have about 10,000 volunteers that walk through our place. It saves us money, but that's not the issue. There's not one person who's a volunteer who doesn't come out of compassion for their neighbor. And therefore, the atmosphere in the agency is one of joy. Because surprisingly enough, when you express compassion, and we have something as simple as providing a meal for somebody, that connection between the volunteers and the clients is almost direct. And that's a joyful thing. And one of the things that Ganga brought, which I think DIFFA saw in her, was a bit of the Mother Teresa idea that there was dignity in these people and in giving them food. So she supplied birthday cakes. She supplied Thanksgiving meals. She supplied Christmas meals, so that the people who were dying were treated with respect and dignity. And that was part of the mission, and that's built in. We still have it. And I think DIFFA saw that as a unique combination in her and in the mission of the organization. And I think that was part of the appeal. DIFFA was, I think, one of our earliest supporters because so many of the DIFFA community had so many of their community affected by AIDS. And it was personal. And that personal connection with the DIFFA organization and the people within DIFFA towards the AIDS community and towards our mission, I think was crucial. And I think their first grant was dictated in part because of that. The reason I was drawn to God's love is that I have AIDS, and I have AIDS probably since the first 80. Most of my friends died, and died before 1990. I buried 2 lovers. I feel obliged to help and show the same compassion towards everybody who has a chronic disease as I felt towards the AIDS population. So it's very personal on my part. The first client was somebody I dated. The clients they served in the beginning were people I knew. So it's quite personal. And I want us now to be the prominent experts on medically tailored meals for the whole country. We are already the leader in New York, and we are the leader among other like organizations across the country in understanding medically tailored meals and providing them. And I personally believe that that's going to be key to keeping people healthy. I draw enormous satisfaction from this.
Can you say you're a survivor?
And part of the reason I'm doing this is I'm a survivor, and I didn't do anything to survive. I just came from a gene pool that somehow allowed me to stay alive. And it's interesting. There's a whole group of us who are survivors, and oddly enough, that causes as much emotional impact as our original diagnosis. Because what's it mean to survive? And what's our obligation as survivors? And how do we adjust to the fact that we're going to live? And a whole series of other emotions come up. And so as a survivor, I'm acutely aware of how lucky I am and how unique. And after 20 years of burying people, to be 83 is a miracle. So I saw my son married, my grandchildren grow up. It's been wonderful.